Phlebotomy Quizlet. Question 1. What additive is in a lavender top tube? EDTA. Sodium citrate. Heparin. No additive. Lavender tubes contain EDTA, an anticoagulant that binds calcium, used primarily for whole blood testing like CBCs. Question 2. Which complication involves inflammation of a vein? Phlebitis, syncope, hematoma, petechiae. Phlebitis is the inflammation of the vein wall, often caused by repeated venipunctures or indwelling lines. Question 3. Which vein is most commonly used for venipuncture? Median cubital, basilic, cephalic, femoral. The median cubital vein is large, well anchored, and least likely to cause nerve damage. Question 4. Tiny red spots on the skin after applying a tourniquet are called petechiae, ecchymosis, purpura, hives. Petechiae are small, non-raised red spots indicating a coagulation abnormality or that the tourniquet is too tight. Question 5. Leaving a tourniquet on too long can cause hemoconcentration, hemolysis, petechiae, hematoma. Prolonged application of a tourniquet causes blood pooling and hemoconcentration, altering test results. Question 6. What is the most common site for venipuncture? Antecubital fossa, dorsal hand, foot, scalp. The antecubital fossa of the arm contains the median cubital, cephalic, and basilic veins, making it the preferred site. Question 7. If a patient faints during a blood draw, the first step is to remove the tourniquet and needle, call a code, provide oxygen, slap their face. If syncope occurs, immediately remove the tourniquet, withdraw the needle, and secure the patient to prevent injury. Question 8. What does the gauge of a needle indicate? The diameter of the lumen, the length of the needle, the volume of the tube, the sharpness of the bevel. Needle gauge refers to the size of the internal diameter or lumen. Larger numbers mean smaller diameters. Question 9. Which complication occurs when blood leaks into surrounding tissue? Hematoma, edema, thrombosis, phlebitis. A hematoma is a localized collection of blood outside the blood vessels, often causing swelling and bruising. Question 10. Which item is used to clean the site before routine venipuncture? 70% isopropyl alcohol, povidone, chlorhexidine, soap and water. 70% isopropyl alcohol is the standard antiseptic used for routine venipuncture site preparation. Question 11. Which tube should be drawn first in the order of draw? Blood culture, yellow, light blue, red, lavender. Blood cultures must be drawn first to prevent contamination from other tubes and ensure accurate microbial testing. Question 12. Fasting typically means no food or drink, except water, for how long? 8 to 12 hours, 4 to 6 hours, 2 to 4 hours, 24 hours. Standard fasting requirements for blood tests like glucose or lipids require an 8 to 12 hour fast. Question 13. What test requires the sample to be chilled in an ice slurry immediately? Ammonia, CBC, cholesterol, BUN. Ammonia levels can rapidly falsely elevate if not chilled immediately after collection to stop cellular metabolism. Question 14. What is the standard angle of needle insertion for venipuncture? 15 to 30 degrees, 45 to 60 degrees, 90 degrees, 5 to 10 degrees. An angle of 15 to 30 degrees ensures safe entry into the vein without going through the back wall. Question 15. Which additive acts as an antiglycolytic agent? Sodium fluoride, heparin, EDTA, thrombin. Sodium fluoride preserves glucose by preventing glycolysis, the breakdown of sugar by cells in the tube. Question 16. The breakdown of red blood cells is termed hemolysis, hemostasis, hematopoiesis, hemoconcentration. Hemolysis is the destruction of red blood cells, which releases cellular contents into the serum and ruins results. Question 17. A light blue tube contains which additive? Sodium citrate, EDTA, sodium heparin, potassium oxalate. Light blue tubes contain sodium citrate, which is crucial for coagulation tests like point-NPTT. Question 18. When should a phlebotomist label a patient's tubes? Immediately after the draw, at the bedside, before the patient enters the room, after returning to the lab, at the nursing station. Tubes must be labeled in the presence of the patient immediately after the draw to prevent mix-ups. Question 19. Which needle gauge is most standard for adult venipuncture? 21 gauge, 16 gauge, 25 gauge, 18 gauge. A 21 gauge needle is the most widely used size for routine adult venipuncture. Question 20. What is the primary function of a centrifuge? To separate blood components by density, to count red blood cells, to sterilize samples, to mix additives. A centrifuge spins at high speeds to separate whole blood into plasma/serum, buffy coat, and red cells.